I was born and raised in Washington State and lived for a few years in Hawaii, and I've never really had any exposure to the issue of circumcision until I went to medical school. I went to medical school in St. Louis, Missouri, at St. Louis University, and that was where I first saw a circumcision done on an adult, and I found that quite appalling. And then I went on to do my residency in family medicine in Milwaukee, Wisconsin, and was expected to learn to perform circumcisions on neonates. I felt from the very beginning that there was a problem with circumcision, and I finally quit doing circumcisions in 1988 after I finished my residency. So I've been a conscientious objector, I guess you could call it, for a number of years, or for my entire medical career. I'm a recovering circumciser, I guess you could say, and believe me, I do feel that circumcision has, the fact that I performed circumcision did adversely affect me, and I think that I'm still trying to deal with that issue. But for the last 10 years working in a residency program, I've actually had to mentor family medicine residents in their training. And we have had a number of residents come through that have been conscientious objectors to circumcision. When I started 10 years ago, while they keep working on this, I'll just keep talking, I guess. I started 10 years ago, and most of the residents were performing circumcisions as part of their training, and they felt that they had to do that. Some of those residents told me privately that they didn't want to be doing circumcisions. Over the past 10 years, there have been a number of changes that have occurred, and I just wanted to outline my experiences with these changes, or over the past 10 years, with this issue of being a conscientious objector. And to start out with, I'll just tell you that Marquette General Hospital, which is the hospital I work at, is a tertiary care center. We have about 700 or 800 deliveries per year, and almost over 95% of those end up being circumcised if they're male, unfortunately. Does this, okay. So I think I covered, yeah, and I do have three children. They're all adults now, and they're all intact, male and female. And so I didn't really have any problem making that choice when I had my children. I don't think I even discussed it with my husband. I just said no, they weren't going to be circumcised. I didn't really care what he said. It just wasn't going to happen. So anyway, we have I train at residence, and it's a 3-year program. We have 18 residents total, 6 per year, and we have about 6 full-time faculty. I'm the only faculty that's actually vocally opposed to circumcision, and I've made that very clear over the years. We have medical school graduates of varying nationalities, cultures, and religions, and that has been one of the major factors that's changed over the past 10 years, is that they used to be primarily American born and bred, and now we have a lot of foreign medical graduates, and that's actually helped with the circumcision issue. We have had various OBGYNs and pediatricians come and go over the past 10 years, some of which performed circumcision, some of them didn't. And then out of the family medicine or family practice faculty, 3 of us do not do circumcisions and 3 do. And we have other family medicine docs in town. One group of 3 is opposed to circumcision, and they advise their parents against it. And then we have about 4 or 5 other family medicine docs that do them and really don't have a problem with that. But the issue over the past 10 years has been that more and more doctors at our hospital are not doing circumcisions, and then we do have the resident doctors, of which about a third of them are refusing to do circumcision. So oftentimes there's nobody available to do any circumcisions. And this has made the nurses, and no offense to any nurses, I don't want to rile up anybody, but nurses are my best friends are nurses, but we do have a lot of OB nurses in our birthing unit who are very pro-circumcision, and they tend to get frantic about the fact that parents are requesting this procedure. The residents who tend to be low on the totem pole, so to speak, they tend to get caught in the crossfire. So that's what I've had to be mentoring them about. And again, we have a very high circumcision rate. Most of the doctors even circumcise their kids. Our OB nurses are, as a whole, not all of them, but they tend to be very pro-circumcision, and this has been a major issue in the hospital. We have a lot of parents that come in, they demand it, they think they have the right to do this, and the staff supports them in that right. And then we have the resident physicians who tend to be mostly, conformists. They don't want to ruffle any feathers. They feel they need to do this and get out and finish their residency in 3 years and get out. Again, most of them are young. They're usually in their 20s. We've had some older than that, but that's pretty normal. Most of them are born and trained in the U.S. And I'm sure that most of the males that are U.S. born and trained are circumcised. However, we have had some residents that are from an Eastern Indian or Pakistani Indian background that are not circumcised and have been born in the U.S., and they've been quite vocal about being opposed to circumcision, which has been nice for me and for, of course, the children they're taking care of. As a whole, resident physicians, they love to do procedures, but when it comes to circumcision, they're really not feeling the love there. So, but overall, most of the resident docs are going to be very respectful of authority and hierarchy, and they're very easily influenced by their peers and the nursing staff and the attending physicians. And so if a lot of them do feel pressured to learn and perform circumcisions. And a lot of them think it's a requirement to do this to get through the program, and so they end up doing a lot more than they actually would like to. Now, over time, we've had a change in the makeup of our residency program. Again, we've got a lot of foreign medical grads, which is what FMG stands for, and a lot more females. And these resident physicians tend to be more opposed to circumcision. So, we sometimes have a third or higher of our residents who are refusing to do circumcisions. We also have a lot more residents being vocal about being opposed to it, as opposed to in the past when they just kept their mouths shut. And I think that I've had residents tell me that they feel that because I have been supportive of them, that they have been more empowered to speak out against it. So I do feel good about that. And then, of course, Dr. Van Hal also practices there, and he's opposed to it as well. So they tend to use us as the go-to people when they have a problem with it. The U.S. graduates and the females tend to be much more vocal about saying no, and the foreign graduates tend to be quieter because they just, they feel that they're out of their element culturally, and they don't want to make waves. A lot of them are there on visas and could get kicked out of the country, so they tend to be very, a little more reluctant to speak out. And so we have... Now, the experiences over the past few years with this issue, because of the fact that more and more residents and physicians were not performing circumcisions, we did have one a family medicine attending back in 2005 that worked with our program who wanted to make it mandatory that residents perform circumcisions, and she wanted to impose penalties. And unfortunately, this was a female who was kind of disappointed in her. But I actually brought up the fact that the conscientious objector status issues and the legalities of forcing residents to do this, and the issue was then dropped. And subsequently, we, as a program, we allow our residents to opt out of any procedure that they find ethically repugnant to them. So we are one of the few programs, well, at least in Michigan, that we're affiliated with, that apparently that allows our residents to opt out without any questions asked. We do have a number of residents who are Catholic, who opt out of doing abortions and prescribing birth control. So, it's pretty much the similar issue. But the problem is that then there's no one available to do the circumcisions, and again, that makes the nurses get really panicky. And so the past few years have been quite volatile in our institution from this perspective because of this issue. So just to go through the conscientious objector status definition, originally this started out with the UN Commission on Human Rights, and it was in relationship to military service, but it was where an individual claimed the right to refuse to perform any procedure on the grounds of, or perform military service on the grounds of freedom of thought, conscience, or religion. And then it became, it was translated over to in the medical field, and it's the notion that a healthcare provider can abstain from offering certain types of medical care with which they do not agree, and it could be care that's otherwise medically appropriate. And then the Michigan Conscientious Objector Policy Act of 2004 was set up to protect healthcare providers from retribution if they decided to invoke their conscience and refuse to provide medical care. And it would allow providers to decline offering care if they felt that it compromised their beliefs, except in the event of an emergency. Well, of course, circumcision does not qualify as an emergency. So, and then in December of 2008, the Department of Health and Human Services passed a medical conscience rule, and it protects entities and individuals from reprisal if they choose not to provide certain medical services that violate their conscience. And this was set up primarily as a response to the abortion issue. It doesn't specifically discuss neonatal circumcision, and it actually applies more to providing services to adults. So it does help to protect providers and educate about these protections and hear grievances. And interestingly, that any healthcare entity that is found to be in violation of the new law would be subject to a termination of federal support and funds. And I'm sorry that this is kind of wordy here, but I wanted to go, to list this in detail what it specifically says. So it prohibits recipients of funding to coerce individuals in the healthcare field into participating in actions that they find reprehensible or objectionable, and prohibits discrimination if one does not participate in these specific procedures. Again, this was more for abortion and sterilization. But it went on to say that we shouldn't be forced to choose between our good professional standing and violating our conscience. But of course, these laws don't say anything about minors. It basically applies to adult patients requesting care, and neonatal circumcision is not done on an adult, and it's certainly not medically indicated or any kind of a medical emergency. So that's a little bit of an issue there, alteration. So what have the issues been for being a conscientious objector? Well, for our residents in particular, they're often asked why they object to it, why they won't do it, and this is usually by either their fellow residents who are circumcising babies or by the the nursing staff. So they tend to just give ethical reasons, and they often will say, just talk to Dr. Storms. They tend to pass it up the line because they don't want to have to take responsibility, or they don't want to have to take on all that load there, and that's fine. I tell them they should do that because I'm more of the authority figure than they are. But the nursing staff has really never specifically talked to me about why I don't do them, which is interesting over the past 10 years. In our institution, the resident doctors do a lot of the circumcisions just because they are, at the bottom of the heap, so to speak. And a lot of the pediatricians and OBs that don't want to do them, they pass it on to the residents. But the nurses are very much in their face about, you need to do this, you need to find somebody to do this. We've had 3 residents over the past year who have come to me and said, I feel like I'm being harassed and pressured. I don't want to do this. And I have told them many times, you do not have to do this. You do not have to facilitate finding someone else to do something that you consider torture or unethical. But oftentimes they feel, really backed into a corner over this. The residents that perform circumcision tend to make them feel that they're dumping work on them, that they're passing the buck, so to speak, and there's a lot of guilt involved there. So I've had to address that issue, but I'll discuss that in a little bit. And then we have a lot, again, these pro-circ nurses. They have discussed the ethical beliefs of physicians with patients, or with parents of patients, which I do not feel is appropriate, and other physicians involved have not felt appropriate. They have given parents the message that those doctors not performing circumcision are somehow inferior. They have transferred the care of infants to other circumcising physicians, which has been a point of contention. They have filed incident reports against physicians who would not arrange for circumcision to be done. And their response is always, well, we're just trying to be an advocate for the parents. Obviously, I don't feel they're being an advocate for the patient because the patient doesn't want this done. They have often ridiculed the non-circumcising physicians, and this is basically a form of harassment. They are not very direct in their approach with myself or with other attending physicians like Dr. Van Houw. Usually they do this in a covert way and by dealing with the residents who are not going to talk back to them the same way we are. And so that's been a problem. Now, one thing that I have done to try to address the educational aspects is to have a lecture on circumcision. And we did this in October 2009, and I passed out information or gave them information to read ahead of time about the anatomy and function of the foreskin and how to care for the intact penis and what the history of it was. And I gave them an article that Marilyn Milos had written about the whole issue of what was behind all this. And we had quite a room filled to capacity that day, and unusual situation because the residents actually did their readings, and usually they don't do a lot of their readings, and so, but this time they really did do their reading, and I found that interesting. And just to say that I actually felt very uncertain how this talk was going to go because this was the first time I'd ever done this, and because of the fact we typically get harassed about this, I was a little apprehensive about it. And I found myself thinking, well, what am I going to do if they start attacking, because this is typically the way it happens. And I also think that I still have trauma from having done circumcisions, and I feel this really brought up a lot of emotional issues for me. But I found during the lecture that we had, it was more like a discussion, but we discussed the anatomy and function. We discussed a lot of the issues about the HIV studies and the biases and complications and whatnot. Really the residents and the medical students that were there, and some attendings were even there, they had no understanding of any of that, none. It was just like totally new information to them, which is unfortunate because that means that, well, I know from my medical school training I didn't learn anything about it, and the only thing I was taught in residency was it was not done for medical reasons, and there was no reason to do it. But otherwise, there was nothing. I wasn't taught anything, and most med students and residents aren't taught anything about it. So that was eye-opening, and I really felt that what I came away with from that lecture was that they were really hungry for information and wanted to hear what we had to say. Afterwards, some of them did come up and ask, how can we quit? And I said, yes, you can quit. You don't have to continue doing this. So it was kind of interesting. And then we went to the AAFP, the American Academy of Family Practice Conference, which was the following week, where Dr. Van Houw and I were involved with manning the booth for Intact America with Georgianne and various other people. And we found that a lot of physicians opposed circumcision and didn't circumcise their own kids, but they were still circumcising other babies, and some of them, a number of them asked for more information. Some of the physicians were angry and hostile, which was to be expected, I guess. But we did have a resident that stopped by from Michigan, a Michigan State University family medicine program, which is actually she's from Grand Rapids program, which is actually one of the programs within my circle of residency programs that I am affiliated with through Michigan State University. And she said that she was not allowed to stop circumcising even though she didn't want to do it. She said she would be fired if she didn't perform circumcision. And I said, well, that's not true. You have the right to be a conscientious objector and not do this, and you should not have to be fired over it. So I went back to Marquette, and I contacted the chair of the family medicine department through Michigan State University, he's the chair of the department for our program as well in Marquette. And I explained to him what was going on and that I felt this was not acceptable. And so we had a teleconference with all the program directors. There's like 10 or 12 of us in that Michigan State University program, or all the programs together. And I gave them a little information ahead of time about the conscientious objector, information from doctors opposing circumcision. And basically they understood that this should be allowed, that residents should not be forced to do this, and they were willing to change their policy on it or make sure that all the residents knew about it. And that's basically what I wanted, was for them to make sure that the residents were aware they had this option, because apparently, obviously they didn't know that in other programs. But it was pretty clear to me that these were all males. I'm sure they were probably all circumcised. They asked me questions like, well, what really is the problem? One of them and then went on to say, well, the rest of the world circumcises. And I said, no. I explained that wasn't really true. And he kind of backed off after I started giving him a lot of information. And it was pretty clear that they didn't know a lot of what the issues actually are. So, overall, we've had the problems over the years that I've been a conscientious objector, I guess, or been opposed to this. In the last 10 years at the program, we've had issues dealing with the anger and the harassment and the taunting and ridicule and what basically boils down to unprofessional and unethical behavior, and actually now illegal behavior to some degree. We had to decide how to approach administration and how to deal with this. And I've listed here, a number of areas that we can work on with education and how to stop facilitating circumcision in our hospital. And I just, felt that one of the things I have listed on the bottom here is ignore this with a question mark. And of course, for me, that's not really an option. I tend to speak my mind, and I've been pretty vocal about it over the past 10 years at our residency program and hospital. And I've found that it's good to be assertive. It's good to try to remain relatively unemotional about it if at all possible. But because of the harassment of these 3 residents who came to me, I did go to the chief medical officer and I explained to him that this type of harassment would have to stop. And I pointed out all the legal issues and the laws in place. And our chief medical officer is a pretty reasonable person. And very much against harassment and very much in favor of professionalism and all that. So he said, he assured me that it would stop. Now, as of 2 weeks ago, it hadn't stopped because I just was up there and got nailed again by one of the nurses. But and then he was talking about setting up some parental education. I basically pointed out to him that I thought the nursing staff needed some education. And but he said, well, we should talk to the parents. And I said, well, the parents usually have made up their mind, and they have to either be educated before they hit the birthing unit, or the nurses have to stop pushing this. And so basically at the last pediatric meeting, of which I'm on the committee on that for that department, they brought up the American Academy of Pediatrics brochure, which I looked at. It's from 1995. It's extremely biased, in my opinion, and inaccurate. But we're going to talk about this again in September, so we'll see where that goes. And again, of course, I have to continue working on educating the staff and the residents and other physicians. And I do find that some of the other faculty are supportive of my position. The ones that don't, well, the rest of them, except for one physician, they're all males, and I'm sure they're all circumcised, but they do feel that we have to be supportive of the residents, and they're quietly supportive, I guess. So, what do we do at this point? I guess I'm going to continue to point out to the chief medical officer if there's incidences of harassment. I guess we could file some complaints. We'll have to see how things go. And so I do feel that over the past 10 years, we've had some positive changes. We've had more and more doctors are speaking out at where I work and saying they're not going to do circumcisions. Mostly they just say they're not going to do it and they walk away. They don't really get into all the issues around it, but I can tell that a lot of the doctors are very uncomfortable with the circumcision issue. They don't like the fact that parents are demanding to have this done. But I feel they need to step up and say, well, no, we're not going to do this anymore. And the nurses are going to have to, we're going to have to deal more with that. I do think we've touched a nerve with the nursing staff. At some level, they must feel some guilt over this or some issues. I can't imagine that they don't. And then the residents are more empowered now. I'd like to think that Dr. Van Houw and I have had something to do with that. And they have come to me and have said, you know, they thanked me for my support and for being there to back them up. So we're going to continue working on the education, and I think, you know, where do we go from here? Trying to support one another, set up educational opportunities. I've found that over the last few years it's easier for me to speak out about it and be calm about it and less emotional. I have to be empathetic to other people's belief systems and realize that it's difficult for people to change their belief systems even with the facts being given to them. I'm amazed at how if something doesn't coincide with a person's belief system, they're just going to totally blow it off. So that's my experience.
Thank you, Michelle. We do have some time for some questions.
Wow, okay.
Sure. One back here.
Norm?
Hi. I have my RN license in Michigan, and I graduated from Michigan State.
Okay.
So I'm planning to move back to Michigan in about 6 years when my youngest graduates from high school. So this will be really interesting because I'm a conscience objector also. And I think one of the big things, because when Medi-Cal stopped paying for circumcision in California, the rates dropped dramatically. So when Michigan stops paying for circumcision, I think that will definitely help the cause.
Yeah, yeah.
Yeah, and they can't afford it.
Right, oh yeah, we have no money. Yeah.
Michelle, I wanted to thank you and Bob so much for doing the work that you're doing in the Upper Peninsula of Michigan.
Well,
as you
thank
know,
Norm, for your work.
Michigan has the highest rate of circumcision for non-religious reasons in the entire world.
Right. It's,
Just two